Pharmacological treatments for secondary prevention in atherosclerosis and their efficacy. As Flegg and Associates discuss the need for effective secondary prevention against atherosclerotic cardiovascular disease, ASCVD, is important for the older adult population. Current trends show that the ageing population is growing and placing a large demand on the cost related to ASCVD, which is only expected to increase dramatically. As you can see in Figure 1, the economic strain from cardiovascular disease is greatest of all groups, with a large impact indirectly also. Secondary prevention is key to limit the prevalence of reduced quality of life and increasing demand on long-term care, which are both indirect expenses related to atherosclerosis. The endothelium plays a major role in assessing early development of atherosclerosis, as it has a critical role in the regulation of vascular function. Decreased bioavailability of nitric oxide and impaired endothelium-dependent vasodilation are key indicators of endothelial dysfunction. Nitric oxide production and release to vascular tissues and cells displays a protective role in the cardiovascular system. Nitric oxide relies on an enzyme, endothelial nitric oxide synthase, to catalyze the formation. However, with increased stress on the endothelial system, results in a breakdown of reactive oxygen species, which in turn cause endothelial dysfunction. Flow-mediated dilation of the brachial artery is the chosen approach to distinguish the underlying mechanisms of endothelial dysfunction, as it is a non-invasive procedure using ultrasound analysis of the brachial artery. This approach has been widely used amongst studies as it strongly predicts cardiovascular events in patients with cardiovascular disease. As atherosclerosis cannot be cured, the goal is to stop or slow down the atherosclerotic process and thus preventing consequential cardiac events. This is achieved by repairing endothelial dysfunction or reduce endothelial dysfunction, as it is one of the early features in the development of atherosclerosis. Beginning in childhood, atherosclerosis unnoticeably advances until eventually it clinically manifests and reveals other associated cardiac risk factors. As Robinson and Gidding explain, treatment would be ideal and more effective in the early stages of atherosclerosis when plaque stabilization and regression can occur. Having said that, regulation of the endothelium has surfaced as a key indicator of atherosclerotic events. Monitoring the injury and repair of the endothelium has helped to measure the progression or regression of atherosclerosis, as well as improve quality of life for individuals with atherosclerosis. We know that hypertension, type 2 diabetes, and high blood cholesterol all contribute to atherosclerosis. Which pharmacological secondary treatments have the ability to reduce endothelial dysfunction, therefore delaying atherosclerosis, and importantly, how well do they execute their role and prevent consequential cardiac events? Non-pharmacological methods to treat hypertension are always suggested as initial therapy. However, combination drug therapy has been shown to provide increased efficacy in the treatment of hypertension. Not only has it been proven to be more effective, but also individual drug dosages can be prescribed with a lower dose, which reduces dependence on the drugs and longevity of the treatment plan. The following antihypertensive drugs: diabetics, beta-adrenergic blockers, angiotensin-converting enzyme inhibitors, angiotensin receptor blockers, and calcium channel blockers have contributed to reduced cardiac events in older adults. In the past, beta blockers and diuretics haven't demonstrated a positive effect on endothelial repair. However, with newer beta blockers available, there have been some notable developments. Vasari and Associates discovered that nebivolol and cardivolol have shown improvements in endothelial dysfunction. Nebivolol encourages vasodilation by stimulating nitric oxide synthase, thus initiating a protective mechanism on the cardiovascular system. Carvedilol works to decrease reactive oxygen species generation and improve endothelial dysfunction. Calcium channel blockers particularly have shown to repair endothelium-dependent vasodilation by improving nitric oxide bioavailability. ACE inhibitors and angiotensin receptor blockers have also shown to enhance endothelium-dependent vasodilation. Is endothelial dysfunction resolvable? I believe it can be significantly improved with treatment. The way I interpret the findings from Vasari and Associates is that hypertensive medications need to exceed antihypertensive results in order to show repair or improvement in endothelial dysfunction. In addition, hypertensive medications have the ability to go beyond their role of blood pressure lowering and assist with the improvement of nitric oxide bioavailability. There is increased bioavailability if there is an increase in endothelial nitric oxide synthase or suppression of reactive oxygen species. This is a strong indicator of endothelial repair, resulting in slowing down of the atherosclerotic process. A number of researchers have concluded that increased glucose levels can result in severe endothelial injury due to a buildup of reactive oxygen species. Results from a study investigating the buildup of ROS due to increased glucose supply were administered adiponectin, which regulates glucose levels and breaks down fatty acids. Endothelial dysfunction was measured and determined that high glucose conditions increased reactive oxygen species by 3.8-fold after about 16 hours. Adiponectin dramatically decreases glucose-induced ROS by 81%. Hypoglycemic treatments are therefore comparable to antihypertensive medications, showing repair to the endothelial dysfunction. Flegg and Associates states statins remain the first-line therapy for secondary ASCVD prevention. Recent studies have confirmed that the benefits of using simvastatin in low-density lipoprotein cholesterol-lowering therapy demonstrate significant reduced relative risk associated with treatment in comparison to placebo. A reduction of 13% all-cause mortality, 18% in vascular death, and 25% in stroke were noted. Statins demonstrate their lipid-lowering objective and also have the ability to increase plaque stabilization, stimulate endothelial progenitor cell recruitment, increase nitric oxide synthase, and therefore increase bioavailability of nitric oxide. And they also have an anti-inflammatory effect. This then results in repair of the endothelial function. Davington explains that the ability of statins to have a positive effect on endothelial function is not surprising and is supported by a short-term study investigating treatments with fluvastatin for 6 to 12 weeks. Results confirm a significant increase of 30% in endothelial dysfunction. Moderately elevated cholesterol levels were treated with simvastatin compared to placebo and demonstrated significantly increased vasodilation responses. Furthermore, statins are effective in lowering LDL cholesterol as they have been shown to increase the production of endothelial nitric oxide synthase, which in turn allows the formation and increased bioavailability of nitric oxide. Many studies focus on LDL cholesterol lowering therapies and their ability to significantly reduce morbidity and mortality. However, an analysis conducted by Libby looks at the function of high-density lipoprotein, which participates in reverse cholesterol transport, transferring cholesterol from tissues back to the liver. Furthermore, HDL carries antioxidant enzymes which may prevent the initial inflammation process and influence atherosclerosis by blocking the early steps and slowing the progress of the disease. In addition to Libby's findings, a study by Tiso confirmed that HDL might increase endothelial progenitor cells, EPC, which make up the lining of blood vessel walls, and initiate endothelial repair due to an increased number of EPCs. Furthermore, an in vitro study with mice demonstrated that the number of EPCs significantly increased more than double after intravenous infusion by HDL. Looking outside pharmacological treatments, a study by Sonoshin and Associates assess how exercise may also stimulate EPCs and promote repair of endothelial damage amongst participants with metabolic syndrome. Flow-mediated dilation was the technique used to analyze the study and establish that moderate exercise training increases the nitric oxide production of early endothelial progenitor cells. So yes, pharmacological treatments are beneficial, but exercise is also an effective treatment. Some practical applications for professional practice when treating a client with atherosclerosis should include an understanding of what medications your client is prescribed, how the medications may affect your client's ability to exercise, understand not only your client's physical limitations but also psychological, assist your client to discover underlying motivation to commit to rehabilitation and how they can achieve their end goal, work cohesively with fellow allied health professionals in an effort to achieve maximum health benefits for your client. In conclusion, secondary prevention for patients with atherosclerotic cardiovascular disease requires implementing treatments to reduce recurrent cardiac events and mortality, which in turn can improve quality of life for individuals with atherosclerosis. Atherosclerosis can be managed by measuring injury and repair endothelial dysfunction using non-invasive techniques such as flow-mediated dilation. The slowing of the atherosclerotic process can be achieved if effective secondary pharmacological treatments are prescribed.